Can you become a registered nurse in 12 months? Well, yes, you can. So definitely keep watching. My name is Christina and welcome to a new video. Thank you for being here today and watching my video. If you want to learn more about how to become a CRNA and how to grow your CRNA career, definitely subscribe and hit the bell so you don't miss anything. Today we're going to talk about how you can become a registered nurse in 12 months. So a lot of times, I hear many students or professionals are like, you know what, I want to become a nurse. I would love to, become a nurse. Maybe I want to become a nurse practitioner. Maybe I want to become a CRNA, or maybe I just want to be a nurse on the floor. Maybe become a nurse administrator. So, it's very popular nowadays to have a second career as a registered nurse. And there are a lot of programs out there today that give you that opportunity to be successful to achieve that degree. So there are programs nowadays that allow you to become a registered nurse in as little as 12 months. Now, of course, this is something called an accelerated BSN program. So what this means is that maybe you have a degree in something different. Maybe you have a communication degree, an art degree, a psychology degree, and now maybe you've been working in your profession and now you're saying to yourself, you know what, I want to become a registered nurse. So you can apply to certain programs and become a registered nurse in as little as 12 months. So this is called an accelerated BSN program, okay? Now, so a lot of the programs, to give you some honest truth behind it, yes, you can get it as some programs are 12 months, but it can be, usually the range is 12 to 18 months. That's usually the range depending on the program. And there are some few programs that it can take up to 2 years, which to me seems long, but those are some programs that are out there. But there are few programs that allow you to get it as little as 12 months. Now, that does not include getting your prereqs for that specific, degree, for example. So you still have to, before you even apply to the program, so same example, the program's as little as 12 months, you still have to, even though you have an art degree or a psychology degree or maybe a communication degree, you still have to take coursework to be allowed to even apply to the program. So some examples of classes that you may have to take before you apply to an accelerated BSN program would be microbiology, anatomy, physiology, also chemistry, maybe statistics. So these are some few classes or coursework you might have to take in order to apply to a accelerated bachelor's degree program in nursing. So when you're thinking about those programs, for example, it is very fast-paced. It's very accelerated. So, you'll be taking a lot of classes. It may be, you have fall, you have, winter break, you may have spring, you may have summer, but it's an all year program. So it's not like you're going to have a break like most programs where you have, winter break or summer break. A lot of the programs are all year round that you are taking coursework in order to, become a registered nurse fast. Now, before you even think about, I want to go to an accelerated BSN program, what should I do now? So I would think the first step would be to, of course, get your prereqs, get those specific courses that are required for the program of interest. Then you may have to take an entrance exam. So depending on the school, they may have a specific exam they may want you to take in order to be accepted, to be an applicant for their program. Then I would recommend that the classes that you are taking as your prereqs, make sure that you have a minimum of a 3.0 to 3.5 GPA. Of course, depending on the program, that might vary, but to be a strong applicant for that program, they really recommend a minimum of a 3.0 GPA. And also, I also recommend that when you are going ahead and taking the coursework, definitely try to be involved in extracurricular activities, maybe something in your community, maybe something in your current job that you can actually, put on your resume. Because you also want to have a nice, strong resume, because it's very popular, this type of program. It can be very competitive. So you want to have a strong application, you want to have a strong resume, also your personal references, you want to have that strong as well. So, it allows you to have an easier transition to getting accepted and going into the program. Now, to get a little bit into CRNA, for example, so saying you're like, yes, I want to become a CRNA and I'm an art student, for example, you'll do the same exact steps that I told you in regards to becoming a registered nurse, and you become a bachelor's prepared registered nurse with this accelerated degree. And then you have to work a minimum of 1 year in the ICU. However, of course, more years of experience really strengthens your resume and strengthens your application, and you have a higher probability of being accepted with more years of experience versus 1 year of experience. However, there are rare occasions where students are accepted with 1 year of experience. But you gotta think about it too. What type of experience are they having? What type of involvement they have. So you gotta take that into perspective when you're thinking about, trying to get to become a CRNA fast. Then, you gotta take your CCRN exam, and then, of course, be involved on your unit, charge nurse, maybe co-team, maybe part of committees, doing research. Those are some examples. And then you can go ahead and apply to a CRNA program. So definitely take that into consideration when you're thinking about that. And, if you really want to become a registered nurse, you can do it. Nothing should stop you. There's a lot of opportunities out there to grow and allow yourself to become a registered nurse, as well as becoming an ICU nurse, as well as if you want to become an advanced practice nurse, being a nurse practitioner, for example, maybe a certified midwife, maybe being an educator, or even being an administrator, or even becoming a CRNA. So there's a lot of variety and options in nursing, which are amazing. And maybe you may say to yourself, clinically, I'm not really into the clinical setting, but there's a lot of different areas you can work in. You can do clinical nurse specialist, you can be an educator, like I said before. Maybe you can work in IT, working on the electronic health record. There's so many opportunities in nursing, which is amazing. And if you don't like one area, you can always change. It's very easy transition. So I hope this video was able to help you. So if you want to learn more about CRNAs and how to grow your CRNA career, definitely click one of the videos over here, and I'll see you in the next video. Thanks for watching.